Hi, everybody. This is our first Faces of Cancer on a WebEx. So we hope that it works. We hope that you hear everybody. We have three absolutely terrific speakers, and it's going to illustrate, I think, the point about survivorship, which Dr. Myers will talk a little bit more about. There's 18 million people this year living with all types of cancers, surviving at various points in their life, either with a disease, being treated from a disease, just diagnosed, to the various time points. But when you get diagnosed with a cancer, you're considered to be part of survivorship. And as the momentum grows and as treatment becomes more successful, as we realize that there are different proteins on cancers that we can treat with targeted therapies with less toxicity, there are more and more people living with less complications, long and short term, from treatment. Of course, there are the complications of growing older, as 2/3 of the people that are surviving cancer in the country are over the age of 65, and 70% of them have some sort of medical issue, whether it's coronary disease or diabetes or obesity. I actually read recently that 2/3 of people, adults, are considered to be overweight, and 1/3 of all kids are considered to be overweight, and that really plays a role in the development of certain cancers. So I don't want to go on and on about what happens when you survive cancer, because we have three great speakers who are going to tell us about it. And before that, I'm going to introduce the head of our survivorship program, Dr. Marlene Myers, who I'm very fortunate to call my colleague, who is just 2 doors down from me. And as all the speakers can attest to, I'm in her office all the time asking her questions. So I'm very happy to be able to introduce someone who's very knowledgeable about the subject and who really has, a heartfelt way of approaching breast cancer, because that's what she treats. But I suspect that if she treated all cancer, she would approach that in that kind of universal way, because she's just such a wonderful individual. So I'm going to introduce the head of survivorship, associate professor of medicine and a medical oncologist, Dr. Marleen Myers.
You are so sweet. Thank you so much. And right back at you. We're so fortunate to work together and to be able to run things off each other. And I think what the most important thing is that we share is an incredible commitment to our patients, a true love of our patients, and really the keep talking, a true love of our patients, and really this quest and this passion that we have for making people's lives better. And that really leads to survivorship. And the concept of survivorship is, I'm happy to say, a relatively new one, because it wasn't all that long ago that we sort of felt that keeping somebody alive was enough. That if someone was living, that was good enough. They couldn't ask for any more. We couldn't ask for any more. But then what happened was we have more and more and more survivors, people who are living beyond cancer, people who are living with cancer for long periods of time. And while you will hear today that you'll hear from three remarkable, remarkable women, their stories are very different, but I think there is a communal thread in our survivors, and that is that people want more than life. They want quality of life, they want meaningful life, and they want good health. And it's very much our obligation, if we're going to treat people, to try to ensure as best as possible that this happens. So with that came the survivorship program that looks beyond treatment, beyond chemotherapy, beyond radiation, beyond hormone therapy, into quality of life issues and lifestyle issues. How can we mitigate side effects? How can we make people's lives better? And very importantly, we have to keep in mind that people who have cancer also have the potential to get other diseases, some possibly from cancer, some not, some from family history. And very often we put these aside when we're treating our patients. And that's where survivorship comes in to be very important, because we do have to focus on minimizing the risk of high blood pressure, diabetes, cholesterol. We have to look forward to lifestyle changes, to nutrition, exercise, all of which help to improve survival and improve quality of life. So what we're going to go on to next is our three remarkable speakers. They each have a different story, as I said. We'll give you the opportunity to hear their remarkable stories. And then we'll come back, and feel free for the audience out there, if you have questions, please type them in and send it to us, and we'll do our best to answer the questions. Without further ado, our first speaker is Paige, and Paige is, well, I guess I can say that all of the three remarkable women that we have today, Dr. Axelrod and myself both have the great privilege of taking care of all three, and truly it is our honor and privilege to do that. So let's hear from Paige first. Paige?
Thanks, Dr. Myers, and I wanted to say thank you so much to Dr. Myers and Dr. Axelrod for asking me to do this. And being honest, if it was 2 years ago or several years ago, I might have said no, just because it didn't feel to me like it was far enough in the past. And so this was actually the perfect time for you to ask, because now it has been 6 years. So we've been in this relationship, the three of us, yeah, for 6 years. And I'm just very thankful now to be able to talk to people about my story, which this is a part of my whole story, and also maybe hopefully answer some questions that you have that maybe you don't have access to answers for. So to tell you where my journey with this started, very, very unexpectedly in 2014. It was beginning of April in 2014, and I was actually stretching. I was stretching because I'm a yogi, and I was feeling tight, and I was massaging my pec muscles, and I thought, oh, well, I'll do my breast exam, because I do, do my breast exams all the time, like we're supposed to. And I was massaging here and found something and thought, huh. And I checked the other side and I was like, what is that? I don't think that was there before. And it just felt like a small knot, just like a small knot, maybe the size of a chickpea. And I thought, okay, that's weird. So I made an appointment with my GP, who was also my gynecologist. She had just seen me about 2 months before that. And of course, they exam you there, and as far as we know, nothing was there. And so we decided, after she examined it, that I should probably go have a scan, and then that led to having a biopsy. And so on April 24th, 2014 is when I got my diagnosis. What it looked like was DCIS, which is ductal carcinoma in situ. It was inside a duct, and it was very small, and it seemed very early. But she said, and I'll never ever forget these words as we started to talk about what was going to happen next. She said, "This is going to suck, but you're going to be okay." And those words have stuck with me forever, because the objective was to get to the part where you're going to be okay. And she also showed me a list of hospitals, and she pointed at NYU, and she said, I think these are your people. She knows me. She knows I'm into very holistic health and natural health. And she said, I really think that these are the people that will work for you. And so the following week, I was in an appointment with Dr. Axelrod. And we went from thinking that, well, I went from thinking that this was going to be something small, we'll take care of it, it'll be all over. And it went from thinking it can't possibly be the big C word, because no one in my family has ever had cancer. No one in my family has ever had breast cancer. And so this was not even on my radar. And that's also my word of wisdom to everybody else, is that I'm one of the people that is in the category of this can happen to anyone. And we all have to do our checks and be very careful and be very in tune with our bodies. But I went from thinking this was just going to be a lumpectomy to it's going to be a mastectomy. And then we decided to do a double mastectomy. So my whole world completely changed within a matter of days. But the way that Dr. Axelrod explained everything to me, I remember I was bawling my eyes out, and she took the tissue box and she said, "It's not the way it used to be. It's not what you're thinking. It's not the scary pictures you've seen." She's like, "This is the breast, right? And there's tissues inside. I'm gonna take the tissues out, and then the box is still there." Do you remember that, Dr. Axelrod? That's how you explained it to me. And I thought, oh, okay, that makes sense. And so less than a month later, I had the double mastectomy. So it was Dr. Axelrod alongside Dr. Miha Choi, who has had the I hope pleasure of operating on me 6 times. So we've been through a lot together. And then after we did the mastectomy, the double mastectomy, we got the results back. It did not spread to my lymph nodes, but I believe, HER2 positive, and the cells were being a little bit, aggressive. And so when I was told we're gonna make you an appointment with oncology, that was another huge shock to my system. I'd never even thought that I was going to need to take this step. And again, the doctors sort of huddled together and said, who should we put her with? She's going to get along with Dr. Myers. And thank goodness, because Dr. Myers was able to explain to me, also in shock and crying, how this was going to work, what was laying ahead, and how this was going to go. And so after that, I did do 3 months of chemo. So it was Taxol with Herceptin, because I was HER2 positive. And then once we did, so it was 3 months, once a week for 12 weeks. And then after that, we continued for the rest of the calendar year, doing once a month Herceptin infusions. And during the course of that time, of course, I was doing reconstructive surgeries. I had a little bit of a setback when I started chemo, which they handled beautifully. I had an infection that I couldn't fight, and Dr. Choi took care of it immediately. And then, as she said, we're going to make everything look so pretty. Don't worry. And she fixed everything. And then when we got to the end of the Herceptin treatment, I did start, I guess it was after I finished chemo, we did start on 5 years of tamoxifen. So I was on tamoxifen for 5 years. I just finished it last October, which was also a wondrous moment to kind of shut that door as well. But I want to say that I could not have asked for better support from my friends and my family. And I told a very small group of people. I'm very, very, very private. And I really did not want people to watch me going through something terrible. And it was better for me and healthier for me for very few people to know, and to try to keep going about my life as best I could. And also in my, in my job, I didn't really want people to know. And so I'm a classical musician. I sing opera. and symphonies mainly in oratorio, and I did not want to show up at rehearsal or to my job during the day. I'm an executive assistant. I did not want people seeing me go through the phases of treatment and knowing what was going on. So it took me a long time to open up to people, and that was my choice, and that was healthier for me. But the tribe that I chose to tell, they're in my community, they're my tribe. I could not have asked for better support, and also the care that I received at NYU was incredible, and they made everything available to me that was completely tailored to my particular case and me as a person, which was incredible. They supplied me with counseling. They recommended acupuncture. They had massage therapists come into your chemo appointments, and there was a Reiki specialist. There was pet therapy. I didn't meet the dog, unfortunately, for my schedule, but there is pet therapy, and they also are so innovative, and they're always looking at, yep, go ahead.
Can I just ask you, so what's the kindest thing one of your friends did during your illness and recovery?
Oh, that's, wow. It's tough to choose one thing. Being with me, it's hard for me to allow people to help me and do things for me. But I did have a fleet of friends who came in after various surgeries and, stayed with me, prepared meals, brought things to me, went to appointments with me, which was incredible. A friend of mine, who I think is on the line, he went with me to an appointment after my last surgery, and it was an incredible thing for someone to take time out of their day to just go with me and be with me. And also, one of the kindest and most incredible moments, and there were so many incredible moments in the care I received, was in Dr. Choi's office. I had sort of an emergency happen in her office after I had an infection, during which Dr. Choi, because she is incredible, turned her office into an operating room and actually operated on me while talking to me about opera and asking me what my favorite roles were while she's doing this operation. And then when it was over and I was really out of it, and I went into the waiting room, and Michelle, who works in Dr. Choi's office, saw me, and she was like, whoa, 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 sit down, because I was just white. And she said, what happened? And she sat down next to me, and I said, I'm sorry, I feel like I'm gonna pass out. I haven't eaten anything. I feel like I need some fruit or some like candy or something. And she's like, hold on. And she went into, I guess, the staff kitchen, and she brought out a piece of birthday cake because someone in the office had just had a birthday. And she sat there with me in my, haze, and ate birthday cake with me so that I wouldn't pass out. And that was incredible. That was really incredible. I hope that sort of answers it. I'm sure I'm going to think of a million other things that come up after this.
We'll have, I hope, plenty of time to, as people ask questions and go on. Thank you. That was really beautiful. Let's hear from Dawn.
Hello, I'm Dawn Elin Fraser, and I am an arts professor at NYU Tisch. And I'm mentioning all of this stuff just because because working in the arts and being an artist is a big part of who I am, and it's a big part of something that I think is really important that I'm going to mention in a minute. So I'm a voice, speech, and dialect specialist. I do a lot of shows off Broadway, regional theater. And so in the summer of 2017, two really eventful things happened. So I had this, and it was one day, and it was separated literally by like a day. So one day I went to this interview to coach the Broadway production of Once on This Island, which won a Tony Award for Best Revival in that season. And before I left the interview, the director said, I really want to use you on this project. And this was like, you know, like a pinnacle in my career, you know, calling my friends, I'm crying, I'm so excited, it's amazing. And then the next day, I got a call from my OBGYN saying that I'd gotten my scans back and I did indeed have cancer in my breast, in my lymph nodes, and in my liver. So it was really like, you know, and it's interesting because when I think about it now, I remember thinking, I hope this means I can still work on the show, you know, because it was this moment that I was like, Once on This Island is this really beautiful parable about love and forgiveness that's set in, it's set in the Caribbean, in the Antilles, and in the Antilles, and I'm West Indian, my family is Guyanese, and I just really wanted to be the person to help, you know, shape and guide the sounds of this project. It was really important to me. And I just remember all I could think was like, if this cancer keeps me from working on this effing show, I'm gonna be so mad. Like that's what I remember thinking. And in terms of discovering it and deciding to go to the doctor and find out something, I was brushing my teeth in the mirror, you know, in the morning, just, you know, a little topless brushing. And I noticed that one of my nipples looked like it was inverted. And I was like, Nip, you don't usually look like that. Like, what's going on? So then when I got in the shower, I thought, oh, let me examine. And then I made an appointment. And all of this to say that as a person who was a freelance artist for a really long time, now I'm housed within a university, I got really used to being underinsured. And so thinking of my insurance only as like in case of emergency, like if you get in a car accident, thank goodness you have insurance, you know what I mean? Or like if you break your arm, thank goodness you have insurance. And I'm sure that there are a lot of people in the same boat that now have, you know, comprehensive insurance, but you've never used it that way. So you don't think, oh, I should be getting, you know, these checkups, I feel fine, all of that. So all this to say, like if you are sort of transitioning from being underinsured to being fully insured, I just want to really encourage you to take advantage of that and to let go of any shame you have around being underinsured or not insured at all. Let go of any shame about like having to say to the doctor, you know, when they say, when was your last mammogram? And you have to say never, you know, letting go of the shame around that. Because your physicians are your allies. They're not your adversaries. And I think that, you know, in a lot of communities of color, it's sort of set up that your physician is actually an adversary. They're trying to catch you. They're trying to gotcha you. And that certainly was not my experience at all at NYU Langone. So I had these tests, and then I met with Dr. Axelrod, and on the same day, she introduced me to Dr. Myers. I think that my treatment path was a little bit different because they decided that I wouldn't have surgery right away, that I would do Taxol with Herceptin and Perjeta to see if we could reduce what was going on, and then continue to take a look to see if I would be a good candidate for surgery. And so one of the things that I think is really great is that I actually did go on to coach this production, which was so important to me. And one of the things that happened while I was working on that is I started treatment and my hair started to fall out. And I think that Dr. Myers, the one time where I really sobbed in your office was I said, when am I going to lose my hair? I had dreadlocks, you know, past the bra strap, like long hair, and sort of like, I don't know, to jolt myself out of being so attached to that, I started referring to it as my pretty, pretty hair. You know, so I would say to my friends, yeah, you know, these are the last days of my pretty, pretty hair, so you better take a picture, and like to just sort of reorient myself to that. What I do know is that we as human beings are wired for struggle. And we're wired to figure out strategies, which are all unique to help us figure out our way through that struggle. And one of the ways that that works for me is to encourage myself to sort of like deflate the bubble of drama, you know? So my hair started falling out, and I was like, you know what, just call it your pretty hair and see, and it sort of, it let my friends be more easy with it as well. One day I went to the beauty supply store and I bought some clippers and I just shaved my head, and it was very empowering and very liberating. One of the things that I talked to Dr. Axelrod about was the fact that friends would often ask me like, oh, can I come with you to your treatment? And, will that be helpful? And I was also going once a week for a really long time. And the first time I had 2 friends come with me, and I was really glad they did, just because I didn't know what it was going to be. But then after that, I found that I really enjoyed doing it by myself. And as a person with a full-time job and also a freelance career, it was great to have like these 3 hours are just for me. So it's sort of like, even though, I'm doing this treatment, it's like there's nothing else that I can do in this moment but be with myself and kind of commune with myself. And one of the things that sort of emerged from this is part of my practice as an artist is when I'm researching something, I try to find an affinity with the person or thing that I'm researching. I'm working on this adaptation of Edith Wharton's final novel, The Buccaneers. And one of the things that Edith Wharton was sort of prolific at, besides her novels, was letter writing. So I decided to write a letter a day for 365 days. And part of what sort of became part of that practice was that on Sundays when I was in chemo, I would write letters to Edith Wharton. So while I had that space and that time, and the clarity, and not a lot of noise and emails and, people asking for coaching and all of this kind of stuff, I wrote these letters to Edith Wharton, and that's going to be part of the project. I wrote a blog about it for the Morgan Library and Museum, because I'm a researcher there. I don't think that anyone can really describe this experience as like something that you're thankful for, but I am thankful for the clarity that the experience has allowed me to embrace. It sets priorities like nothing else, in terms of things that you want to do and people that you want to be with and things that you want to say no to. And I do really, really appreciate that. And so many of the moments in this journey that have been so exciting have happened to me when I was in rehearsal. I was in rehearsal for a tour of Finding Neverland when Dr. Myers called to tell me that I would be ready to stop doing Taxol. I was in a rehearsal for What the Constitution Means to Me when Dr. Myers called to say that there was no new growth for the first set of that no new growth. And on Tuesday, when I had my video call with Dr. Axelrod, I was in the middle of prepping for a new production, an all woman and non-binary production of 1776. It's going to be at the Roundabout, when Dr. Axelrod told me that I would not be having surgery because everything had been dormant for long enough. So these are sort of like, the connection between the two is really important to me. I know that some people may choose to step away from what they're doing in terms of their work or their profession or their avocation. And for me, the thing that was sort of like the hook that held me on to this plane, I feel, is the fact that I felt I still had things to contribute to my art form and to my students. So I'm so thankful for both Dr. Myers and Dr. Axelrod, and thank you. I'm so thankful to NYU Langone, and thank you for giving me the opportunity to talk about it.
Well, thank you for coming to us. And you are obviously, as anyone listening can see, full of incredible grace and poise and, so wise, way beyond your years. So I have a question for you. Did
Sure.
your students know about your journey? Were they aware? And how do you think that affected the interaction with them?
Oh, that's such a good question. So I have a really good friend who is a stage 4 colorectal survivor. And she was such an amazing advisor and consigliere and friend. And the one thing she said to me is that you get to decide who you disclose to and who you don't. And it doesn't have to follow a pattern. Like, and you can have two people who are sort of on the same tier of friendship, and you can tell one and not tell the other. And, that's your business. So what I decided with my students was, especially because it's acting school and so much of it is about like allowing yourself to be seen. And I really felt strongly like this is a part of who I am now. So I really have to, I have to model what I would like them to do. And so I wrote them all this email where I told them what was going on with me. And I asked them two requests. One was not to bring it up unless I brought it up to them. And the other was not to use any sort of warrior language or rhetoric around me and my cancer. And this is not to say that anyone who feels like they are a warrior at war with their cancer, that they can't think that way. But for me, I just felt like, for better or worse, it's my body and it's a part of my body. And the notion of being at war with my body is not palatable to me. And I also didn't like what it said about the people who unfortunately did not survive. You know what I mean? If you're a warrior and you don't survive, what does that make you? Like, I just didn't like all of that. So, we have a rather large department at Tisch. Our studio is the largest department in the drama department. And of all the students I teach, only two of them sort of breached that, which was quite interesting. And it's this thing that we call centering. It was really important for these two students to sort of center what was going on with me around them. And I sort of talked them through that, like why that maybe wasn't the healthiest way to approach things. Like, you really can't make my cancer about you. My cancer can't be an excuse for you not to engage. And in modeling, if I'm still engaging and it's actually in me, then that's an invitation for you to engage as well.
That actually, I think I'm going to use that. I'm going to use that because that is perfect. I mean, what an amazing thing to say to people in such an incredibly powerful way. So thank you, Dawn. We look forward to hearing more during questions. So our next speaker is Bakaro, who also Dr. Axelrod and I have had the pleasure of taking care of. And let's hear your story, please.
Oh my God, my story.
Your story.
My story is different from everybody else because, like, I lost my mother from breast cancer, and I have like two sisters, and I always thought, oh, maybe it's not gonna happen to me. Maybe it's gonna be the other one. Maybe like I'm gonna escape. And on 2017, I was taking a shower and I started to touch myself, and I felt a lump, and I said, it was that's cancer. I was just by myself, okay, that's cancer. And I tried to make an appointment with my gynecologist to get like the prescription to get a mammogram. And I got a mammogram, and I just did the mammogram, and after they did like, the sonogram. And the doctor or the nurse told me like to wait. And fortunately, like, the doctor I was talking to, or the nurse, she's French. And I told her, like, I know I have cancer, She's like, no, maybe it's not a cancer, maybe it's just like a cyst, nothing. I said, I'm not scared. And then I think I heard her behind, like, talking, and she was kind of like, I think she was thinking it was cancer. And I stumbled, you have like, the way to the mammogram room, and you have the other way to Dr. Axelrod and Dr. Myers area. And I had just run over there to Dr. to this side, said, I'm going to die, please do something, get my breath up and do something, because and the first person I met was Dr. Axelrod, like, but that's not the way he works. I said, what I'm going to do? And then from there, everything stopped. She I mean, she scheduled anything for me. She made an appointment with the lovely Dr. Myers. Everything. They did everything. I don't even know. I mean, like, you know, they just, like, I was surrounded, like, you know, with those wonderful women. I had, like, a wonderful team, like, just from running from one room to another. That's what happened. And also, it was, like, I accept my disease because, like, I used to be a model, and my resume was my body. And the thing is, like, you know, that's sometimes, like, you know, when you do jobs, you just, like, you know, your body, people use your body, like, you know, okay, you fight here, you big here. You just, like, talk about your body like, you're not even there. And I was like, okay, what I'm going to do, I'm going to accept his disease like a job. Like, every time I'm going to go to the hospital, I'm going to act like I'm going to the casting. I will wear my red lipstick, wear my wig, my sunglasses, like, you know, acting like all cute and going to my appointments, to the doctors, and taking the doctor like they're my friend. And, like, you know, they're really my friend. Dr. Myers was like my girlfriend, like, you know. And Dr. Axelrod too. We're talking about anything, like, you know, during the appointment, we'll talk about, like, vacation, talking about any kind of thing. And also, and when I did chemo, from, like, they explained to me, like, I'm going to get, like, you know, because my case was, like, a genetic. I carried the gene, and Dr. Axelrod, sent me, I think Dr. Axelrod, she sent me to see a Dr. Smith, and I carried the gene, and they explained to me, they told me, oh, okay, you're going to have a double mastectomy. I said, okay. And also they said, oh, you will have, like, Dr. Myers told me, like, oh, you're going to get you have to get your ovaries removed because in case, you know, it goes together. And especially, like, you know, when you carry the gene, the ovarian cancer is like kind of like a silent killer. You only, when you almost at the end, that's when you start to feel the pain. You don't get nothing. Then I had, like, my ovaries removed, everything. The only thing I was worried about, like, you know, I was saying, oh my God, Dr. Axelrod was like, I said, oh my God, Dr. Axelrod, I think I'm getting fat. She's like, oh no. I said, I don't know what I'm going to do. That was my only, like, you know, kind of concern because I was like, come on, girlfriend. You know, they were like, you know, my audience. But when it comes to support, I like the support of the best doctors. I think, like, you know, it's kind of like the wind blow me in that room over there. I like the best support, and I had the support of my husband and my kids. They were, like, amazing. But also, the funny part is, like, you lose friends. This disease show you, like, you know, who your truly friends are. And you pick friends, and there's some friends, they were looking at me like, I like Ebola. I was like, oh my God. It was sort of like it was like contagious or something. I was still shocked. And also, like, Dawn, I didn't want to be a part of that sort of warrior nonsense, survival. Yes, you know, I'm a survivor. I'm gonna fight this. I'm like, you know, I'm fighting for what? I'm just blessed to have, like, you know, a good team of people who are taking care of me, and knowingly, like, you know, having, like, you know, family in Africa, and knowing, like, you know, some woman in Africa didn't have the same opportunity I had, because in Africa, the woman, they would just, like, cut the breast off. If you don't have any money, they didn't have. I remember, like, I was talking to Dr. She didn't. In Senegal, they didn't have a radiation machine. The woman, the people who had money, they had to fly to Morocco to get, like, you know, the treatment. And I'm like, you know what? I'm just like, they're like, oh, some people were saying, oh, you're a survivor. I said, I'm surviving for what? I'm like, and I'm breathing. I'm not in war. I feel blessed because I'm like, you know, I'm having, like, the best team, like, you know, who are taking care of me. Why I would be, like, you know, surviving against what? Wow, what? I'm not fighting against anybody. I'm here, and I like Dr. Myers, we're like, oh, you know what? Everything's gonna be fine. I'm gonna make sure you're gonna live until you'll be 80 and this. I was like, okay, you know what? I was really, really good. And the best thing, you learn through this disease, like, the team, the people you surrounded yourself with, and especially, like, your medical team who truly understand and can talk to you like a human being. If I had, like, a little concern about, like, for example, like my book size, I was like, oh, Dr. Myers, I wanted, like, to have a bigger book. And she was like, oh, I understand the feeling. Okay, you can do this. And she was sort of like guide me, like, kind of like, they will understand everything I will go through. And I didn't need to have, like, people were telling me, like, oh, maybe you should get, like, psychotherapy. I said, no, like, because I don't know, there was, like, a connection between me and this woman. And it's like, I was just blessed.
So, it's interesting, Cora. So, I mean,
Yeah.
I think it's interesting that we have three speakers who have had breast cancer. And when we asked you guys, I wasn't even thinking about it, but you're three artists. You're a fashionista, a model, an artist, you, and a singer, and you all didn't allow what?
I'm not a singer. I cannot sing.
No, you can't sing.
What you all didn't do is you all didn't allow your cancer to define you. And so that, I mean, I think that for us as clinicians, I think it's super important that the patients are defined by how they were before, what they want to be, what their aspirations are, what they want to finish. And, it's, and because I think it's almost defeatist to define yourself as a stage, as a grade, as a profile. I mean, I don't think that is really helpful. I know we have a question about the funding for metastatic cancer. And I think there has been a lot of, I think Laura in the audience had a question. I think we've made a lot of strides in the treatment of metastatic cancer, especially with targeted therapies. You heard about Dawn's experience. It's slow because we don't have the same number of women who present with with other stages that are not metastatic, where we can have like large cohort of women where we study them. But I think that the funds are increasing, and I think that there's a number of organizations that are metastatic breast cancer organizations. I can't speak for metastatic cancer, other cancer, but I don't know if Dr. Myers wants to say anything, because we just had our big virtual ASCO, which is the American Society of Clinical Oncology. It's the largest cancer organization in the world, and there were a lot of different conclusions that came out of it, with a lot of different like drug combinations that were not used before but are now being used. And I don't know if you want to say something about that, but we don't have that nihilistic attitude about metastatic cancer like maybe we did 20, 30 years ago.
Not at all.
Yeah.
I absolutely agree. And yeah, it's not at all nihilistic. And a lot of what came out of ASCO and a lot of what you see on television, I mean, not that I'm a fan of these ads, I think that they're really problematic, but nonetheless, a lot of the ads you see on TV are targeted towards metastatic breast cancer. But what's happening now more and more is the genome, the genetics of cancer is really being dissected, and a lot of these new drugs are for metastatic breast cancer with people who have particular mutations. And that to me is so incredibly exciting. I mean, I think back to my early days as a breast cancer doctor, and basically we had 4 drugs and 2 hormones, and that was it. That was it. That was the armamentarium. And now there's, I don't know, 30 or more different drugs with what even this past year, it's been so exciting. And as Dr. Axelrod said, there are organizations that are very specifically fighting metastatic breast cancer. There's a very large coalition, which is really wonderful. I just also want to make a comment that I was really struck by, uh, that I found fascinating, that you don't want to be seen as a warrior, and Dawn, I think you made the comment about sort of fighting within your body. And that to me really resonated, because I think that when we address women or men who have cancer as being warriors and being fighters, it does imply that if you don't survive, that you didn't try hard enough. And I think, we can't stress this enough, that your cancer, and I mean that to everybody out there, is not your fault at all. You did not give yourself the genes. Yes, maybe you didn't have the best lifestyle. It still is not your fault. So, when women or men are sitting home, especially during this time of COVID, when people are afraid to get checked, you just heard three amazing stories about people who found their own cancer. So we certainly don't want people sitting at home feeling things or finding things to be afraid to come in during this pandemic, because medical centers are safe. I can tell you that I feel the safest at Perlmutter at the cancer center than I do in my own apartment, probably.
Yeah, I even have to wear a mask in my house. You know,
We wear masks on Zoom calls, so please, for anyone listening out there, don't be afraid to come in. Don't be afraid. Don't be embarrassed. Go for your screening, and please report any issues.
can I ask? There was a question about yoga from Laura, and about how do they use yoga in their daily lives, in their recovery. I'm not a yogi, so I can't. I'm probably just the opposite, so I can't answer that. I mean, I'm a kind of a weightlifter, but not for the last 4 months. Although I have some soup cans at home. I probably could use them, but I'm just too damn lazy. Anyway, for those people who do, alternative stuff and complementary, how do you integrate that with, and the audience can chime in as well.
So I'd love to hear first, if I'd love to hear from Paige, because Paige is the yogi here. So if you can maybe just describe a little bit about how yoga personally helped you as just one form of using your body, which I think is really important.
I think, I mean, I'm very, very, very into my health and nutrition to begin with. I've been a vegetarian for 15 years. And I'm one of these people, I don't have the BRCA mutation, I don't smoke, I don't have any issues with drugs and alcohol. And my sister said after I got diagnosed, "You're the healthiest person I know, how could this happen?" And for me, the only time that I did not do some sort of physical exercise was when I just could not. And same thing with music. There was a few months there when I could not perform and I could not put the energy into singing. But otherwise, when it was safe for me to start working out again, yoga and also Pilates helped me tremendously. The fact that I've been doing yoga for a long time and that I do live a really healthy lifestyle did help to keep me well during treatment, absolutely. I had a nutritionist there on site who met with me every week during chemo to make sure I was getting what I needed. But also just continuing with my ultimate, nutrition mission, that also gave me a way to have some sort of power over what was going on, because I was able to fortify my body and give myself the strength to let my body do what it needed to do, fight what it needed to fight, and process, the chemicals and recover and heal. And so the fact that I had already been doing that and that I continued it, I know that yogis have a lot of like their muscles have a lot of oxygen in them. You recover well. Yoga also goes hand in hand with singing, with classical music, because of the amount of breath that we need and the amount of sort of a standing stamina that you need singing classical music. And so not only did it help me to feel like myself still, and to feel like I was contributing something and that I had control over something, but also the rehabilitation effects of it. Because you think, I was having surgeries every 3 months for a year and a half. And then another year went by and I had another one, and another year went by and had another one. And my body knew when about 2.5 months would go by, I would feel myself start to slow down, because my body was like, okay, we know this is happening. We're going to slow it down and go into sort of hibernation mode, because we know we're going to have another surgery and we're going to need to be inactive for a little while. But I always tried to stay very, very careful about when I went back. I don't think it's a good idea to push yourself too hard, especially things like yoga where you're stretching so much and you don't want to mess with your incisions or anything. But being able to do yoga really aided in it was like physical therapy, because of how it helped me to open up my chest again, be able to move my arms. Being able to go like that was a miracle after all of that. And also to give you this sort of like strength and empowerment, because yoga, even if it's a really, really hard class, it's also, it's sort of a moving meditation, and you are very, very focused, and that's all you're thinking about for that time. Much like when we're on stage too, that's all you're thinking about.
I wanted to say one thing about that, because if you feel badly that you're not a yogi or you don't do meditation or aromatherapy or anything like that, don't feel badly about it. I mean, everyone likes a massage now and then, but when they looked at studies of women who didn't do any of that and then got diagnosed with breast cancer and then were offered complementary therapies, what they found was that in a short period of time they enjoyed it. It was beneficial, but only for a short period of time, and it didn't continue. They didn't continue integrative therapies because that's not where they were initially. So I don't. I'm just saying that it's great to be able to embrace doing it, but don't feel badly if you don't continue it, as long as you do something. And I think Dr. Myers will talk about the aha moment, but that doesn't always mean you have to totally change your lifestyle and meditate every day.
Absolutely. And let's face it, if we are told to do something, anything that you don't like to do, maybe you'll do it to please somebody for a short period of time, but you're not going to keep doing it. And whenever I talk to somebody about what to do during chemotherapy, after chemotherapy, it's really not about any particular thing. It's about making changes in lifestyle that are the best changes for you, whether it be nutrition, decreasing alcohol, increasing exercise. But it's a big part of that is not defining yourself as you're being all about cancer, and trying to have your mind, your body be strong and focus on other things. And it is a fact that fatigue and lack of exercise begets more fatigue and lack of exercise. So it is important to do something with your body. If for people who love yoga, great. For people who love walking, that's perfect too. You just want to do something, because a healthy mind and a healthy body are a big part of the experience, a big part of what can make the experience much more palatable. If you feel healthy in other ways, and I always tell, it always makes me think when someone comes in and says the phrase, well, before I was sick, meaning the cancer diagnosis, and that always just strikes me, it brings such sadness to me because I don't think of my patients as being sick. I don't think of cancer as being a sickness. I think of it very much as something that we have to treat and take care of. But when I look at my patients, I don't look at you and anybody else as being sick. And it breaks my heart to think that people that you are thinking of, I know you're not, but it just breaks my heart to think that you're thinking of yourselves as being sick, and whatever it takes with strengthening your mind, your body, and living your life, no matter what stage, no matter what you're going through. Be with your friends, be with your family, keep your connections going, keep all of this going. And I think that's so
So
important.
I want to remind everyone about the dog. You know about the dog? Blind in one eye, missing right tail, half an ear. What is the answer to? Lucky. So I always leave this with people. You can always find something good in everything. There's always some hope, and never give up, because if one thing is not right, something else is going to come in and take its place.
I think we have one more question about aromatase inhibitors, and then if anyone wants to make any final comments, please just chime in. So this question is from someone who asked, who mentioned that some patients are told that they should be on, which are hormone blockers, for 5 or 10 years, and now she's in recurrence and was told that she would be on it forever, and what's the criteria for that? And the difference is when we treat somebody in the adjuvant setting, meaning that the cancer is removed and we're giving treatment to try to prevent it from coming back, there is a finite time that we recommend the treatment, whether it's 5 years, 10 years. When someone presents with a recurrence, whether it's an in the breast recurrence or a metastatic disease recurrence, we're concerned that we may not be able to eradicate every cell and want to do as much as possible to keep the cells from regrowing or from rearing their ugly head, so to speak. So that's why the treatment time at that point becomes indefinite. Now, that's what I always tell people now. This is 2020. We've made amazing strides in breast cancer. The answer for today is yes, if you have metastatic disease or you've had a recurrence, yes, you're on treatment indefinitely. But will we say that in 2021? Will we say that in 2022? I have no idea. I can just say that having done this for a long time, for over 35 years now, um, I will say that I never would have imagined 35 years ago that we would be sitting here today with the armamentarium that we have and the progress that we've made and the enormous hope that we have now. And it has been, I always tell people that when I was first an oncologist, it was a pretty boring field, I have to say. It was, I loved the patients, but in terms of what could we offer, we had stuff, but, and now it's tremendous and wonderful. So there is tremendous hope. Um, and I just would, my personal comment is I just want to leave that with everybody. There is tremendous hope. So please, if you're out there and you're afraid or you found a lump or you haven't been screened, don't wait a minute longer. Deborah, I don't know if you want to say anything else.
No, I want to I'm sending a virtual hug to Paige, Vaccaro, and to Dawn. I want to thank you so much. I think it was such a terrific. I think this was our best program, and on a WebEx.
On a WebEx, yes, yes.
Too we
I
can't.
just ask, we want you all back in person when we get to do this in person again.
Too bad we can't get to hug everybody and have more personal connection. But I think this was pretty good.
Yeah. Does anyone have any comments? Anything you want to say to conclude?
I just like I'm just happy like to be here.
Well, we're all happy you're here, Vaccaro.
Yeah.
You too. You too.
I'm
Yeah.
grateful. I'm
Yes.
very grateful that we met you guys.
too.
Thank
You,
you, everybody.
I do have one thing to say. I would encourage you to stop if you are diagnosed, just be really careful about TV shows with, cancer narratives. They're all super tragic. They're all like, these are your chemo friends, and then one of them's gonna. I did not find that helpful. What I did find helpful was that when people would look at me sort of like with a face when I told them that I had cancer, I would say, I don't have TV cancer. I have real world cancer. So don't worry about that. I don't have TV cancer. So, I mean, that is the first thing. If you're going to change your lifestyle, that could be the first thing that you cut out.
And that's kind of professional. So that's really
Yeah.
sage advice. Absolutely.
Yeah.
But can I just ask Dawn to show everybody the wall behind her? The beautiful wall. Can you explain what the note that what the background is? Dawn?
Sorry, Dawn, you're on mute. If you can unmute your mic, please.
I cover clipboards with Japanese masking tape called washi tape. Sort of what I do when I need a little activity. And then there they are. And then, sometimes I'll clip a little note to it. Like, for instance, this one is a note from my dad. The last time they were here visiting, where he says he's going out to get a little snack. He says, "My dear daughter, going to get a bite. We'll see you soon. Love, Daddy." So just little things that I want to sort of collect and save and keep present.
So
Yeah.
artistic. It's beautiful. It's beautiful.
Thank you.
I just wanted to share not a question but a comment that one of our listeners said, thank you for all the great medical information, hope, and examples of resilience. You are all brave, and this has been a gift to me to hear what you all have to say. And 100%.
That's good.
agree with that.
That's why sometimes when I would open up and tell somebody that that I normally wouldn't tell, it was in the hopes that it can sort of normalize it and make it something that they can talk about. And that also you don't know exactly what you're capable of until you come up against things like this. Or if you're, singing an incredibly difficult role and you're training up for it, 5 years before that, you don't know that you're capable of doing it. And I knew I was a strong person. I knew that I was a very, passionate and capable person, but I had no idea the amount of strength that was in me and in the people around me with whom I've chosen to spend my life. And I will say that though this is not the thing that I want to be known for, I don't want to be known by pink ribbons, even though that's a great thing for some people. That's just not my jam. I want to be known for being me, and that I have an entire story, and that this is a chapter and a significant chapter, but the strength that this gave me, and if I can be thankful for this in one way, it's that it gave me this strength to choose a better life. I realized that I needed to choose better things for myself, and it gave me the courage to get out of a bad relationship, to make changes in my environment, and to continue to be who I really was, and to sort of go through a doorway into the world of who I really was all along. But sometimes you need a little bit of extra strength to do that. And
Paige,
if
could you sing something for us on the, like, get the, is that, am I putting you on?
I can't believe you do.
yeah.
Could you sing like something inspiring at the end so that?
Yeah. Oh, inspiring. Oh gosh. Yeah, and I do want to say too that it was by making these life choices and also through music that I met my partner, Jonathan, and I've never been happier in my entire life than I am now. And so I am thankful for all of the steps that it took to get me here. And if going through all of that and going through all of the pain and the changes and the reaction to change, that it just was my whole world was turned upside down for a couple of years. But if that's what I had to do, if that's the bridge that I had to cross in order to get to here and be this happy, then I'm okay with that now. So I'm very, very happy. I'm very thankful, and we're getting married hopefully in September. As long as New York City keeps acting right and wearing their masks and we keep opening up, then we will be getting married very soon. Thank you. It was supposed to be tomorrow. It was supposed to be tomorrow, but now it's in September.
Remember,
I
it's the
also think like
relationship,
like
not
you know,
the wedding, right?
Yes.
It's-
The relationship is wonderful and strong and ongoing. So
that's good.
That's wonderful.
You know, guys, I think also it's like a childbirth. Like, you know, when you never push a baby, you're like, I cannot do it. I cannot do it. Oh my God, I'm so scared. I won't do it. And then it happens. You're like, okay, I did it. And that's like, you know, that's the way I will describe, like, you know, our journey a little bit.
Yes.
yeah, because you look back and you think, there's no way that I did all those things. When you name it, it's like you're talking about someone else, and then you realize, like, I did all of that. I was there through all of that. Yeah,
Exactly.
it seems like you're making it up, you know?
Yes,
Yeah.
it's like no movie.
Yeah, yeah.
But not a cancer movie.
No,
Movie.
no,
Yeah.
not the sad one.
Thank you so much, ladies. Like, you know, you guys are angel. You're doing God's work. Like, you know, your fingers are like God's hand. Thank you so much for everything.
We do it for you. We love you. We're so grateful that you came to talk to us today and so appreciate your comments. It's really going to help so many people, and it's just nice seeing you, period. So,
Really good to see you too. It was really nice to see you.
Okay.
Great to see you.
great to see
Bye.
you soon. Stay well,
Thank you.
everybody.
Thank you so much.
everybody.
Bye, Carol. Bye, Paige. See you soon.
Okay. Bye. See you soon.
Bye.
Bye.
Bye.